this article really was me grappling with information I was learning in my classes. And I was learning that Black women were dying at some of the highest rates from some of the most preventable diseases, and I could not understand why. And the reasons I was being offered, such as the cultural diet's not healthy, or they don't exercise as much as other populations. And that didn't sit well with me, in part because I knew that African American women weren't eating substantially different diets than the rest of Americans. But also I knew Black women. I came from Black women. I was a Black woman, and I knew that we all wanted to live. So this idea that we were intentionally or even unintentionally living lives that caused us to die in these ways was surprising and shocking and honestly infuriating to me. And I just didn't believe it. I was like, nope. And I had white professors, and I was just like, y'all don't know what y'all talking about. I'm finna figure this out and say something about it. You know, that was very young 19, 20-year-old me. And so I wrote this paper because as I was doing my research, I learned that the healthcare system in this country has always been racist, and it has always been sexist. And I started to learn that there was no point in documented history where African American women or the descendants of enslaved women or children of the diaspora, whatever language is, you know, resonates with you, where there was no real point in time where women had equitable access to health care. And so I was making this argument that, look, African American women have always been treated poorly in US healthcare systems. Thus, they've always had poor healthcare outcomes. And so if you really want to look at health disparities, it's not about telling Black women to eat more vegetables. It's not about telling Black women to exercise more. It's not about telling Black women to have better conversations and be more honest with their doctors. It's about looking at the system that is set up for their failure and evaluating the ways in which to either reform it or to chuck it all to the side and to create something new. And so this was my passion piece. This was a piece that really solidified my desire to become a researcher, because I realized that not only were women who looked like me, who looked like my mother, my grandmother, my cousins suffering, but the research that was being done on this population was often being done by people who didn't look like them. And I was realizing that the findings weren't really in support of us. And I was like, well, you know, if I'm going to be here, then I'm going to work for my people, and I'm going to do the best that I can with what little I felt like I had at the time.